my name is Shirley. I'm a student nurse practitioner. I'll be doing your comprehensive examination today. Is that okay?
Yes.
Okay, I'm gonna wash my hands. Okay, so what is your full name and date of birth?
Vanessa T, July 11th.
And where are you located?
Brooklyn, New York.
What is the president's name?
Joe Biden.
Okay, so you're anal time 3. I'm going to inspect your face. Your head is, the contour is normal cephalic, no lacerations on the face, no redness, no swelling, the eyes are not protruding. Your hair distribution is even. There's no hair missing on your eyelashes or your eyebrows. Lips is pink, moist, nose is midline. I'm going to touch your scalp. Is that okay? I'm going to just check for tenderness. Let me know if you have any pain.
Yes.
Any tenderness?
No.
No lumps, no bumps on the head. I'm going to check your visual acuity. What I want you to do is cover one eye.
Mm-hmm.
Read the smallest line you can read.
LTFPH.
Okay, cover the other eye. Read the smallest line.
HPFTL.
Okay, uncover your eyes. Read the smallest line you can read.
LTFPH.
Okay, so you have 20/20 vision. Your cranial nerve 2 is normal. So now what I'm going to do is palpate your face. I'm going to check for your frontal and your temporal.
Mm-hmm.
Temporal is +2. Cranial, frontal, is it tender?
No.
Maxillary, is it tender?
No.
Okay, perfect. Your there's no swelling, no lacerations or edema. So now I'm going to check for your eyes, the direct and consensual of your eyes, okay? So I'm checking both eyes. I see the light is reflecting. Your left eye is constricted and consensual to the right eye. Your the right eye is constricted, and your left eye constricts also, so it's consensual with the left and right.
Okay.
So what I'm going to do is check inside your nose. Let's check for patency, okay?
Okay.
Let me see inside now. Okay, no nodules, no polyps, pink, no not obstructed, no discharge. It's okay. So I'm gonna check your nose patency. So I'm gonna have you smell something. I want you to close your eyes and let's close hold cover. Yes.
Oh, no.
Exclude one nostril.
Mm-hmm.
I want you to smell and tell me what you smell, okay?
Cinnamon.
Okay, perfect. I'm gonna use something else. Cover the other nostril.
Okay.
What do you smell?
Coffee.
Perfect. So, cranial nerve 1 is intact. Patient can smell both in both nostrils, and nose is not intact. Is not obstructed. No polyps. So now I'm gonna go back and check inside your mouth. Okay.
Okay.
Mouth is pink. Tonsils are grade 1. There's no swelling, no edema. Gums are not swollen. Is moist. Stick out your tongue for me. Say ah. Okay, perfect. Cranial nerve 9 and 10 is intact. So what I want you to do is smile for me. Perfect. Close your mouth. Puff up your cheeks. Perfect. Lift your eyebrows. Perfect. Then unpuff your mouth. Thank you. Cranial nerve 9, 10, 11 is intact. So now I'm going to check 7 is intact also. So now I'm going to check your ears. You can pull your hair back for me. Ears is not swollen, no edema, any tenderness?
No. No.
Okay, perfect. I'm going to check your lymph nodes, okay?
Okay.
Your preocular ocular
Mhm.
nodes are not swollen. Post-ocular is not swollen. Submandibular is not swollen. Any tenderness?
No.
Submental is not swollen. Any tenderness?
Mm-mm.
The back of your neck, your occipital is it hurt?
No.
And not swollen. No nodules.
Mm-mm.
Your deep cut clavicle, is it any swollen? Any tenderness?
Mm-mm.
Okay. And your super clavicle is not swollen. No tenderness. No nodules are noted. And your super clavicle,
Mm-hmm.
there's no lumps, no bumps in that area. Any tenderness?
No.
Okay, perfect. I'm going to check for your eyes again. I'm going to see if you're in your optical nerve. Okay.
Mm-hmm.
Okay. So from right to left, I'm checking. There's the red light is noted. I'm going to go closer into the eye. No redness. No redness. No swelling. No redness, no swelling. The optic nerve is round, pink, and there's no AV niggling.
Okay.
I'm gonna also the red light is noted on the left eye. I'm gonna get closer. There's no AV niggling. There's no redness, no swelling. Optic nerve is pink, brown, and round. Okay. What I want you to do is follow my finger. Well, no, actually no. I want you to look at far distance. Look at the object over there on the table.
Mm-hmm.
Now look at my finger. Now I want you to follow my finger to your nose. Okay.
Okay.
Perfect. So your nose, your eyes is able to accommodate and converge.
Mm-hmm.
Okay. So now I'm going to ask you to follow my finger for us to check your optic muscles, okay?
Okay.
So what I'm going to do is ask you to follow my finger up and down. Perfect. So your cranial nerve, if 3 is intact, I'm sorry, 4 is intact.
Okay.
Perfect. So now I'm going to ask for you to check your thyroid.
Okay.
What I want you to do is swallow for me. There's no nodule, no swelling, and no edema in the neck, okay? And trachea is midline. And your the cranial nerve. Is intact.
Okay.
You're able to swallow with a smooth swallowing.
Okay.
So now I'm going to check inside your ears.
Mm-hmm.
Inside your ears there's no redness, no swelling. The eardrum is pearly white. Pearly gray. I'm sorry, pearly gray. The cone of light is at 7 o'clock.
Mm-hmm.
Now I'm checking your right ear. Okay, I'm pulling back and up. Okay, so there's no redness, no swelling in there. There's no discharge in the cranial. The cone of light is at 5, and there's no is intact. Okay. And cone of light is at 5. So now I'm going to check. And now I am going to check I'm going to do a hearing test.
Okay.
This is the Weber test. What I want you to do, let me know if you can hear in both ears, okay?
Okay. Oh yeah, I hear it in both ears.
Okay, let me know if it stops.
Stop.
Okay, perfect. So she has Weber test is intact. She could hear in both ears. I'm gonna check to see her ear conductivity and her bone conductivity to see if it's intact. Let me know when it stops.
It stops.
Can you hear it?
Yes.
Okay, perfect. Same thing in the right ear.
It stopped.
Can you hear it?
Yes.
Okay, so air conductivity is greater than bone conductivity. So now I'm going to check for hold on. Now I'm going to do the whisper test. I want to check to see if you're able to hear. Okay, close your eyes for me. Which ear?
I hear it in my left ear. Okay, I hear it in my right ear.
Perfect. So your ear hearing is intact, and cranial nerve 8 is intact.
Okay.
Perfect.
Great.
So now I'm going to check your lungs.
Okay.
So what I'm going to do is check the diaphragm, make sure it's even.
Okay.
Okay, it's even by 1. And breathe in for me. And by 2. 1 to 2, okay?
Okay.
Perfect. So now I'm going to percuss your back and see if I could feel any
Should I come this way? Leave you better.
yes, I'm sorry.
Thank you.
So now I'm going to percuss to see if I can see if there's any consolidation in all fields. Okay, so the top is there's no dullness, the bottom has dullness due to the organs that's there. I'm going to also inspect this. There's no lesions on her back, even though she decided to keep her clothes on. She informed me there's no lesions on her back or rashes on her back. I'm also going to listen to your lung sounds. Breathe in for me. Breathe in. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. Breathe in, breathe out. So now what I'm going to ask you to do, so I can see if you have any fluids in your lungs, I want you to say E, and every time I put the stethoscope on your back, okay?
E, 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 E.
Okay, I hear E in all fields. Now what I want you to do is do the whisper for me. Whisper 1, 2, 3.
Okay.
Okay. No, I didn't hear anything. No 1, 2, 3. So what I'm gonna ask you to do is say 99 for me.
99. 99. 99.
Okay, perfect. No vibration and is no tactile firmness. I noted in the posterior. So now I'm gonna check the front. You can turn face me. I'm also gonna ask you to say 99 in the front.
99. 99. 99.
Okay, perfect. So now I'm gonna also listen to your lung sounds in the front. The anterior front. Breathe in. Breathe out. 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 Now I want you to say E.
E. E. E. E.
Okay, so now I want you to breathe. Okay, so your lung sounds are clear. There's no consolidation, and there's your respiratory rate is intact.
Okay.
So now what I'm going to do is check your blood pressure.
Okay.
Go relax your arm. Okay, so your blood pressure is 110/80. Okay?
Yes.
Now I'm going to check your radial pulse for 15 seconds. Okay, so your radial pulse is it's 70. Okay, so now I'm going to check your pulses and all of your areas. I'm going to check the carotid artery. Okay, check one side and check the other. Okay, both +2. So now I'm going to check your radial pulse. Both are +2s. And your brachial. +2. Okay, you can lay down for me.
Wait. Take this off.
So now I'm going to check your pulse in the back of your knees.
Okay.
Okay, both are +2. Your tibial is +2 in both the left, right, and your paddle on your feet. Dorsal paddle is on your, is both +2 on your feet. Now I'm going to check your heart. Now I'm going to have you sit up for me. I'm going to check your pulses on your heart. I'm just making sure my pulse is fine. Okay. So I'm going to use the diaphragm first. What I'm going to check first is your aortic.
Okay.
On the second intercostal space. Okay, it's heard. No extra sounds. S2, S1. Then I'm going to check the tricuspids on the fourth intercostal space. no extra sounds. Now, can you lift your breast up for me so I can check your mitral valve? Okay, that's plus 2. There's no extra sounds. Perfect. So what I'm gonna do is also ask you to lay down for me again. I'm sorry. So what I'm looking for is to see if you're there's any thrills or on your in your apical pulse on your fifth intercostal space midline axillary. Okay. Oh, I forgot to check to see. Let me sit forward for me. Sit up and lean forward. So I'm going to check your sounds again to make sure the heart sounds to make sure there's nothing there. So now I'm using the bell. Okay, mitral valve is aortic is strong. It's +2. No extra sounds. Pulmonary is the second intercostal space. No extra sounds. Aortic, no extra sounds, and tricuspid is no extra sounds under the bell. So now I'm going to check. I'm going to check your aortic to see if there's any aorta to see if there's any viewing or. Okay, aorta is I can hear the sound. There's no view it, no thrills. So that's normal. So now I'm going to check your abdomen. Now I'm going to inspect. I have you laid to 3. You already added the 30-degree. I'm going to Actually, no. I already checked your tibial, your radial pulse. So now I'm going to check your femoral to make sure there's no extra sounds there also. I'm just going to palpate, make sure there's no, okay. It's +2. I'm also going to listen to it to make sure there's nothing there. There's no thrills or haves. Okay, +2. There's no thrills, no haves. I'm using the bell. Okay, perfect. It's intact, no thrills noted. So now I'm going to check your radial arteries. Renal. No thrills, no haves. Okay, perfect. So now I'm going to inspect your stomach. Stomach is flat, the contour is normal, and I'm going to auscultate all 4 fields, okay? All 4 quadrants. Using the diaphragm. Okay. Bowel sounds are heard on the right. Now it's on the left. Okay, bowel sounds are heard. Okay, perfect. I'm going to check for I'm gonna percuss to make sure there's no tenderness. Okay, there's dullness. Okay, perfect. So now I'm going to ask let me see. I'm going to deep palpate and palpate your abdomen, okay? Let me know if you feel any tenderness. Any tenderness? Any pain?
No tenderness. Feels good.
Any pain? Okay, no mass is noted, no tenderness is noted, patient is not complaining of any pain. I'm going to also check your liver on your right side to make sure there's no mass. So what I want you to do, I'm gonna palpate. I'm gonna lift, and I want you to hold your breath.
Okay.
Hold. Deep exhale. Okay, no, and no liver was felt. I'm checking your spleen. I'm gonna do the same thing. Breathe in. Exhale. Spleen is not felt. So now I'm going to do the angle, the cost of angle. So I want you to sit up.
Okay.
Sit up for me.
Okay.
I'm going to percuss the lower back. Let me know if you feel any pain. This is testing to see if your kidneys are not in pain. Okay, or any tenderness.
No. No pain. No.
Okay, perfect. No pain. So now I'm going to do your musculoskeletal. Now I'm going to ask you to stand up for me. And we're just checking your gait. Make sure you're able to walk straight. So I'm going to stand here and walk towards me.
Okay.
Okay, gait is normal. Walk back. Perfect. Gait is normal. So what I want you to do is sit back down. Actually, no, I'm so sorry. Let me have you stand up again. I'm just going to check your spine.
Okay.
I want to see if it's in line. Your spine is midline. I palpate your back. There's no mass on your the contour is normal. No sclerosis. No mass is felt as I palpate. Now I want you to bend forward. Perfect. Bend up. Go up and bend back. Perfect. There's no range of motion is normal in the hips and spine. Have a seat. Okay, so patient has good muscle tone. Now I'm going to palpate your TMJ, your jaw, make sure it's intact.
Okay.
So what I want you to do is open, close. Perfect. Is any pain, any tenderness?
No.
Okay, perfect. So patient don't have any pain in the jaw. Now I'm going to there's no masses on her felt or fluids. Any fluids or edema in the jaw. So now I'm going to check the muscle strength of your jaw. What I'm going to do is pull at your jaw. I want you to do not allow me to open your mouth. Okay.
Okay.
Okay. It's 5 by 5. Perfect. Patient has good muscle tone in her jaw. Her strength is perfect. So now I'm going to check her shoulders. I'm going to palpate your shoulders. What I want you to do is push on my hand. I'm going to put, okay, do not allow me. All right. Muscle strength on the shoulders is perfect. What I want you to do is I'm going to test your range of motion on your neck. So what I want you to do is have your ears to your shoulder, your left ear to your shoulder, and your right ear to your shoulder. Perfect. Now what I want you to do is turn your chin to your right shoulder. Turn your chin to your left shoulder. Perfect. What I want you to do is push your head back and forward to your chin to chest. Perfect. Range of motion in neck and shoulders perfect. So now I'm going to check your elbows. Okay. What I want you to do is bend your elbows forward towards you and back. And I want you to do is put your arm all the way back and pull it forward, upwards. Perfect. Now what I want you to do is bend your wrists up and down, flex. Perfect. And do it in and out. Perfect. So her range of motion, her shoulders, her elbows are intact. Wrist is intact. The range of motion is perfect in her arms and in her wrist. What I want you to do is have let me see your fingers. What I want you to do is open and close your fingers. Open and close. And what I want you to do is touch your fingers, your thumb to each finger in both hands. Perfect. So the range of motion and fingers are perfect, and there's no swelling. There's no nodules on her fingers. Okay. What I want you to do with your wrist is roll it. Perfect. Range of motion is smooth. There's no discrepancies in her wrist. So now I want you to do is I'm gonna check your hips. So I want you to stand for me.
Okay.
I want you to kick your legs back. Perfect. The legs to the other leg. Perfect. Actually, try not to hold on to that while you do that.
Okay.
Perfect. And the other foot. Perfect. You did excellent. Okay, you can have a seat. So what I want you to do is for your legs, I'm gonna have you lay flat. I want you to I'm gonna put your foot at 90 degrees. I'm gonna flip it open for you. You okay?
Take it off.
Take off your shoes. I'm gonna put one leg at a time. You're gonna leave one leg down. I'm gonna put this at 90 degrees. I want you to pull the leg all the way back to your chest for me. Perfect. Now I want you to do the other leg. Perfect. Okay, so I'm gonna ask you to do the right leg again. Bring it up. I want you to rotate towards in. Perfect. And I want you to, actually no, I want you to extend out. Okay, perfect. And I'm gonna do the other leg. 90 degrees. Go in and out and perfect. So what I want you to do is also extend your legs. And then check the hips to make sure that you're able to abduct and adduct. So I'm gonna pull your leg out. Perfect. Smooth and in. Perfect. The next your right leg also. In and out. Perfect. What I'm going to ask you to do is flex your ankles upwards. Perfect. First, flex it down. Perfect. Now I want you to do a circle motion with your feet. Perfect. Range of motion in ankles and feet is perfect. I'm just going to palpate your your toes. There's no mass, no lesion, no mass and no nodules on her feet. Perfect. So what I'm going to ask you to do is platter flex your feet. Okay, and upwards again. Okay, perfect. So now I'm going to have you sit up. I'm going to ask you, what did you eat this morning?
I had some eggs and bacon.
Okay. Can you spell beach for me?
BEACH.
Perfect. I want you to remember 3 words for me. Cat, dog, and nose. Okay, so now I'm going to ask you to count backwards from 100 to 80. And using fives.
Okay, 100, 95, 90, 85, 80, 75, 70.
Okay, you can stop.
Okay.
You good. So you did it perfect. What I want you to do is tell me the words I just told you.
Cat, dog, and nose.
Perfect. You have a good memory. Your memory is intact. What I want you to do is stand for me. want you to close your eyes.
Okay.
I'm just gonna check to see if you're drifting away or drifting. Okay, she's not drifting. Her gait is perfect. Expand. Put your arms up for me and close your eyes. Okay, gait is good. Muscle is good. Muscle tone is good. You can put your arms down.
Okay.
Okay, you can have a seat. Now I'm just gonna check your muscle strength to make sure that you're able to resist my arms. Okay.
Okay.
I'm gonna ask you to push against my arms, my hand. Actually, no, I'm gonna do your head first.
Okay.
I'm sorry.
That's okay.
Okay, push against my head, my hands. Okay. Push. Perfect. So her head strength is perfect, and her neck strength is 5'5". I'm gonna ask you to resist my hand. Okay, perfect. You got perfect strength. What I'm gonna ask you to do is put your arms up. Push your arms towards the ceiling. Okay, she resists. Push your arms towards the floor. She resists. What I'm gonna ask you to do is lift your shoulder. One side. Okay, strength is perfect. 5'5". 5'5". What I'm gonna ask you to do is maybe push against your hand. Don't let me push that. Push. Okay, perfect. Against the floor. Perfect. Strength is perfect. What I'm gonna ask you to do is lift your knee. Don't let me push. Don't let me push. Okay. Perfect. What I'm gonna ask you to do for your leg, push against my hand. Strengthen and the legs is perfect. The knees is perfect. 5'5". I'm gonna do your feet. Push against my hand, towards the ceiling. Perfect. Strength is 5'5". Push against my hand towards the floor. 5'5". Perfect on both hands, on both feet. So what I'm gonna do is I'm gonna check your sensory. Make sure you're able to feel. Okay.
Okay.
So I'm going to use something soft and something sharp, and I'm also gonna do vibration to make sure you're able to feel those.
Mm-hmm.
Okay, so close your eyes. Tell me where you feel it and what you feel.
I feel something soft on my forehead.
Perfect.
I feel something soft on my left arm. Something soft on my right arm.
Now put it.
Something soft on my right leg. Something soft on my left leg.
Okay, perfect. So she's able to feel the softness. Now I'm gonna use something else and let me know what you feel, okay?
I feel something sharp on my left arm.
Okay, perfect.
Something sharp on my right.
Perfect.
Something sharp on my face on my left side.
Okay.
Something sharp on my right.
Okay.
Something sharp on my left. My right. And then something sharp on my left leg.
Okay. So I'm gonna go ahead and do another one. Let me know what you feel.
Oh, I feel it on my forehead, the vibration. I feel it on my left arm. Ooh, I feel it on my right. I feel it by my wrist on my right. I feel it on my wrist by my left. I feel it on my leg, my lower leg, my right. And I feel it on my left.
Okay, so she's able to feel sharpness, softness, soft in all extremities. And I'm also gonna ask you to I'm gonna check your finger strength. Open your fingers for me. You can open your eyes.
Oh.
Okay, so I'm gonna push on your fingers. Do not let me close your fingers, okay?
Okay.
On both hands. Okay, she's giving resistance. Perfect. Perfect. Her fingers has good strength, is at 5. I'm also gonna check your I already checked the Ramberg test, the standing and closing the eyes, and you're not eating this sway. So I'm going to also check your knees. I'm gonna have you lay down for me. I just want to put your. Okay. What I'm gonna ask you to do is put the ball of your foot on top of your shin of your the opposite foot. Okay. Perfect. Range of motion is good. Perfect. Okay, that's good. So you can close it. You can sit up for me. So now I'm going to have you. I'm going to check your your deep tilt and reflexes. Okay.
Okay.
What I want you to do is I'm gonna have your arm here. Let me know when you feel it. Okay, good. Have your arms like this, and one arm at a time. Sorry. Okay, perfect. I'm gonna do your wrists. Flex your arm for me. Okay, so now I'm gonna check your knees. Perfect. So her deep tilt and reflex are at ×2 on all fields, in all parts. Her bicep. Oh, I forgot to check the triceps. I'm sorry. I did over here. I think it was.
You did it.
I'm sorry, I did it already. I'm sorry. So tricep, biceps is intact. It's ×2. Radial, I checked the wrist. Radial is ×2. Her leg, knees is ×2. Her feet is able to curl. Oh, I forgot to check your brisk of your feet. I'm so sorry. Can you have you lay down again? Okay, so her brisk it curls inwards. Okay, so that concludes the test. Her comprehensive examination is complete. Thank you for watching.
Thank you.